with its 5 branches across Bangalore.
Happy afternoon, everyone. Welcome to this new episode of GarbhaSandesha. I am Harish Srinivasan. Welcome you all. I first introduce the doctors for today's program. Dr. Maheshwari, welcome to the show. Dr. Maheshwari is the senior consultant at our Hanuman Nagar facility, also the medical director, assistant medical director of GJRHR. Welcome to the show, Maheshwari. Welcome back to the show. You have done a couple of shows with us, so we welcome you back.
Thank you, sir.
Okay. We also have Dr. Swetha. Dr. Swetha, please switch on the video. Yes, okay. Dr. Swetha is the consultant at our Marathalli Center. She's done her FRM fellowship in reproductive medicine and has been working with us for about 2 years now. Welcome to the show, Dr. Swetha. So, we can start with the topic. Today's topic is endometriosis and fibroids. So we'll start with a brief introduction to the problem and to the challenge that people face today. Maheshwari ma'am, can you start with an introduction and the symptoms, the challenges that women face as part of endometriosis? Can we have the screen there?
So in our day-to-day OPDs, we come across a lot of couples with scan report showing endometriosis, or they will have certain symptoms suggestive of endometriosis. And listening to that word only, they'll be so frightened, thinking that they have some condition which is not curable. It is very serious, like it is something which is related to cancer, or they cannot have children like that. With so much of anxiety, they will come. So I just want to briefly explain you like what is endometriosis, what are the symptoms, and how can we diagnose. So usually the uterus has 3 layers, that is endometrium, myometrium, and all this endometrium deposit, this endometrial layer, if it goes and deposits outside the uterus, so that condition we call it as endometriosis. It is nothing but the endometrium, normal endometrium inside, instead of being inside the uterus, if it is present outside the uterus, we call it as endometriosis. So what happens? It can get deposit around the uterus. Most commonly, it gets deposit around inside the ovaries. Sometimes around the fallopian tubes. Sometimes behind the uterus. Okay, that is the most common site. It appears as small dots, powder burn dots. We call it as, which is seen in laparoscopy. Sometimes it can get deposit near the urinary bladder or sometimes near the rectum. Most commonly, like in the pelvic region, it is most commonly deposited. Sometimes in rare circumstances, what happens, it gets deposited in the previous cesarean section scar, or sometimes if any surgery is happened, especially for endometriosis, it can deposit in the surgery site also.
Okay.
So that is how it gets deposited, and we like how the endometrium normally responds to the cyclical hormones. This endometrial deposits also responds to the cyclical hormones and they increase in size. So because this is the basic pathology, there are different mechanisms how this endometriosis deposits happens. There are different theories. One is the normal cells around the uterus can grow, modify into the endometrium and then start growing. Or it can be through retrograde menstruation, we call, instead of the menstrual blood coming down through the vagina, If it goes through the fallopian tubes and gets attached to the ovaries, we call it, that is one of the theories.
Okay.
So coming to the symptoms, usually they will have pain, mainly pain during menstrual cycles, severe pain if the endometriosis is severe. Sometimes this pain will be there even during the LSC scar or any surgery site, which is cyclical. That is only during menstrual cycle they will have pain during that particular site, or they will have increased bleeding or increased like passing of clots. The amount of bleeding may be more, the duration of bleeding may be, menstrual bleeding may be more. Sometimes they will have difficulty or they will have pain during sexual intercourse. If the endometrium is deposited, this endometriotic spots are deposited in the bladder, they will have pain during maturation, sometimes hematuria, or if it is deposited near the bladder, like bubble, they will have pain in the abdomen, on and off, difficulty in passing stools and all. These are the symptoms. So this we can diagnose by, one is by history, the other is by scanning. In the scan, we can see if the endometrium is deposited in the ovary. It appears large, and also there is characteristic ultrasound features by which we can diagnose this as.
Okay.
And also if it is like in the other areas, if it is small deposits, it can be diagnosed by laparoscopy.
Okay. Okay. Thank you, Dr. Maheshwari. Brief explanation. Actually, it clears a lot of basic concepts, and we are able to understand why endometriosis happens. It's not a very scary topic as such. And people, as you mentioned, relate it to cancer and they feel it's closer to cancer. Yeah. Dr. Swetha, now it is up to you. Can you give us a brief intro to fibroids also, so that we can start taking questions?
Yes, sir. As we all know, infertility is actually raising trend in the past decade. So whenever a couple comes for evaluation, mostly almost like 25 to 30% of the infertile couple, the female partner especially, she usually comes with a fibroid report or scan report, or whenever we do a scan, the fibroids are diagnosed. But again, is like all this 25% of people is like fibroids directly related to the infertility? No. Only in 2 to 3% of the patients, this fibroid actually causes infertility. Most of the time, there's be some other associated conditions. Now, what exactly causes these fibroids? Again, it can be either it is genetic or familial related, or also there's something like whenever the patient has the early menarche or early onset of periods or delayed pregnancies, elderly age group. These are the patients who usually have an increased tendency to develop fibroids. And depending upon where exactly, as Dr. Maheshwari was saying, the 3 layers of the uterus. So depending upon where exactly the fibroids are seen, it can be either submucosal fibroids when it is in the cavity of the uterus. If it's in the wall of the uterus, then we call it an intramural fibroid. Then if it is towards the outside of the uterus, then we call it a subserosal fibroid. Okay. Again, depending upon the position, it can be a uterine fibroid or a cervical fibroid, or there's something called a broad ligament fibroid, which is near the attachment of the uterus. Again, depending upon the position of the fibroid, the patients usually have different symptoms, presenting symptoms. If it's in the uterus, then probably they'll have like heavy menstrual bleeding, painful bleeding. If it's closer to the cervix or the urinary bladder, then can be urinary symptoms. Something like retention of the urine, frequency of urine, rectum, it is like the difficulty of defecation. Again, various symptoms they can present with. So probably in the next 1 hour, we can go through how the fibroids affect fertility status and how we can improve the fertility status of a woman.
Thank you, Dr. Swetha. Dr. Maheshwari, actually, Dr. Swetha asked you the question already. We are getting that question from Pratik. Does fibroid cause infertility?
Yes. So fibroids is majority like in a normal reproductive age group. We find 15 to 20% of the women having fibroids. Sometimes like around 40 to 50% are asymptomatic. That is, they won't produce any symptoms. They will be found out incidentally when they go for scan for other things, or when they go for delivery during cesarean section or any other operations. They will like then it will be incidentally found out. But if they are symptomatic, definitely they will cause infertility whenever, depending upon the location. That is, where the fibroid is. If it is very close to the endometrial cavity where the embryos gets implanted, so the cavity shape will be distorted. Okay. And also what happens, and also shape of the cavity is distorted, uterus will be enlarged. If the uterus is enlarged because of fibroid, the time taken for the sperms to reach the fallopian tube will also be increased. And also because of fibroids, the vascularity will be like hampered. So that if the vascularity is hampered, it impairs the implantation of embryos. The embryos cannot go and stick to the uterine inner bit.
Okay.
So and also it can cause pain abdomens during menstrual cycles and during pregnancy, early pregnancy or in the mid pregnancies. Usually it increases in size. Vascularity will get increased. We call it as red degeneration. Then also it can cause abortions and preterm labors.
Okay. What about endometriosis, Dr. Swetha? Does that also result in infertility?
Definitely, depending upon where exactly the endometriosis is affected. Something like most commonly the ovaries are affected in the endometriosis.
Okay.
So when the ovaries are affected, the folliculogenesis, what we call the growth of the follicle, can be hampered. There can be slowing of the follicular growth. There can be like sometimes there's no dominant follicle which is growing at all. The quality of the oocytes can be affected. In turn, the embryo quality is affected. If it is somewhere in the uterus, then probably the implantations are affected. The sperm damage can occur because of the increase in the reactive oxygen species in the uterus also. And if something like when the tubes are involved, there can be anatomic distortion of the uterus. The tubes and the ovaries can be, the relationships can be affected. In turn, hampering the pregnancy conception.
So, does all endometriosis cases result in infertility, Dr. Maheshwari?
So, endometriosis in all cases it doesn't cause infertility. There are different gradings in endometriosis, like mild, minimal, moderate, and severe.
Okay.
So, in very minimal and mild cases, sometimes it goes undetected. Suppose if it is like a spot, like if only minute endometriotic spots are there. So usually it will be diagnosed only by laparoscopy. Even by ultrasound, it is very difficult to diagnose. Sometimes they conceive spontaneously or IUI. So only the gold standard to diagnose endometriosis is laparoscopy.
Okay.
So in the moderate cases and in severe cases, definitely it causes infertility.
Okay. Dr. Swetha, can fibroids turn into cancer? We have a question from Shrikar Bhatt on YouTube. Can fibroids turn into cancer?
Yes, sir. The fibroids can turn into cancer, but this is like really very rare. Only in about 0.5% of the cases it turns into cancer, especially in the later stages of life, something in 6th or 7th decades of life. So it can turn into cancer. So whenever a patient is diagnosed with small fibroids, we say please, if it's not removed, then we say please do have an ultrasound monitoring of these fibroids yearly once or 2 yearly once kind of thing. But the chances are very good.
So after 50, 60 years of age, fibroids can turn into cancer in some occasional cases is the answer, right? Dr. Maheshwari, can fibroids and endometriosis both be seen in the same patient, same lady?
Yes, sir. It can be seen. Both conditions can be seen in a same lady because both of their mechanism of how they are formed and all is completely different. There are even immunological causes also, even anatomic, like there are certain anatomical causes, and even environmental factors are also there, which are common for both. Sometimes in patients, both fibroids and endometriosis can also be seen.
Okay.
So if they are seen with laparoscopy, we can correct as much as possible in the same setting.
Okay. Dr. Swetha, can you please elaborate a little bit on the treatment options available for fibroids? I know there are various types of fibroids, as you explained, but if you can just summarize the treatment options available, it will be very helpful.
Sir, again, whenever we talk in terms of treatment, it depends upon whether, why exactly we are treating the fibroid, whether the patient is symptomatic or not, whether she's desiring the pregnancy or not. Okay, if at all she's symptomatic, then probably if she's not desiring for a pregnancy, then we can treat accordingly. If it's a small fibroid, then probably we can give her something like painkillers or contraceptive pills, also to shrink the fibroids or, to reduce the pains and heavy sores during the period. But if she's desiring for a pregnancy, then the thing comes, what exactly is the size of the fibroid? Where exactly is the fibroid located? All these things come into the picture. If the fibroid is located inside the uterine cavity, then probably it's always best we say, please remove the fibroid, whatever the size it may be, then proceed ahead for a pregnancy treatment. Depending upon her other conditions, whether a simple treatment or the need for high-end treatments like the artificial reproductive techniques, you can try it out. But if the fibroid is something like in the wall of the uterus, or the intramural fibroid, what we call, if it is of 1 to 2 centimeters, there's no need for any removal. We can monitor it and proceed as good with the normal fertility treatment. But if it is more than 4 or 5 centimeters, that is the time we'll have to get it out.
Oh.
Then surgery. I'm sorry, then plan for fertility.
Okay. Okay. Dr. Maheshwari, question. Suppose there is pregnant, the lady is already pregnant. Can she end up being diagnosed for fibroids after pregnancy also? And what are the complications that can arise if fibroids is detected in a pregnant woman?
So sometimes, like a few fibroids, if they are small in size, they go unnoticed, they won't produce any symptoms. So they can conceive also. So
Okay.
during pregnancy, when they do a normal ANC scan to know how is the baby growth and all, then they can detect the fibroids. So in only 20 to 25% of the patients, so this undergoes a condition called red degeneration. That is usually during pregnancy, what happens? The uterus size increases, the blood flow also increases. So when it is happening, when the blood flow is happening, even the fibroid size also increases and blood flow increases. We call it as red degeneration. There are different changes which happens. So most common is red degeneration. During that time, the pregnant women will have severe pain, fever. So when scan is done, we can see there is increased blood supply to the fibroids. So usually these conditions, when they have these conditions in pregnancy, usually medications will be given and symptomatic treatment. So during delivery, if cesarean section is done, only if it is indicated, we can remove the fibroid, but it is not not recommended during removal of fibroid during cesarean section because of increased blood supply and more blood loss. Only if that fibroid is close to the place where baby has to be retrieved or baby has to be taken out, then only it will be removed. So and also after pregnancy also, even during pregnancy, if there is no fibroids also, few years later also they can have the fibroid uterus.
Okay. Okay. Dr. Swetha, suppose there's a lady and she's suspecting that she's having endometriosis. What are the symptoms or what is it that she has to do to really understand whether she has endometriosis or not? What are the self-diagnosis methods?
So, most of the patients with endometriosis, almost like 50 to 60% of patients usually have this chronic lower abdominal pain, back pain, and painful menstruation. And these are the things which can, or whenever they have sexual contact, it is, painful sexual intercourse. So these are the things which can, point towards the direction of endometriosis. There's nothing like self-diagnosis. Probably these are the ones which can indicate. And once they go to a good gynecologist, they probably can do further investigations, evaluation, like ultrasound and all that, and we can find out what exactly, if there's any endometriotic lesions, if the ovaries are involved or not. Probably these are the things. But again, a laparoscopy is the gold standard because in most of the cases, all this minimal endometriosis, mild endometriosis can be missed, cannot be diagnosed using, a clinical suspicion or what we say, the other symptoms, ultrasound, it can't be picked up, the early cases of endometriosis. Probably these are the patients who usually present with unexplained infertility. Then that is, again, it points towards the direction of endometriosis, which we'll have to look into.
Okay. Dr. Maheshwari, we have a question from Sandhya Nekha. How do you treat bilateral hydrosalpinx in stage 4 endometriosis and also frozen pelvis for infertility?
So usually if the flows, that means the condition, whatever they are telling is, usually in the fallopian tubes, hydrosalpinx means there are fallopian tubes which are attached to the uterus. So the function of fallopian tube is, it is a place where the sperms and the egg, they meet, form an embryo. That is the important part for the pregnancy. So if there is any fluid accumulation which is happening inside the tube, means that is called as hydrosalpinx. If the fluid gets accumulated inside the tube, so then what happens? The sperms and embryos, they cannot meet. And also the fluid is because of infection. If there is any inflammation or infection in the tube, this fluid accumulation starts. And they will have certain chemicals which will hamper the implantation of the embryo. So if the patient, if someone is interested, like if they are keen on conceiving and if the hydrosalpinx, if that is fluid collection in the fallopian tube is diagnosed, usually that will be diagnosed by ultrasound.
Okay.
And also symptomatically, sometimes if it is fresh infection, they will have severe pain, fever, and also sometimes vaginal discharge, which is bad smell, vaginal discharge, purulent discharges and all. So when we do our ultrasound, we can see that it is infected. We will give a course of antibiotic, treat it medically. Still, if the hydrosalpinx is persisting, so when we do a laparoscopy, so usually we try to separate the tubes from the uterus. We call it as bilateral tubal clipping or dealing. Suppose if the tube is very unhealthy, they will remove the tube. That is with the consent, like we will explain the couple about all these things. If both the tubes are removed, then the chance of conception is good. They have to try IVF for pregnancy. So if one side tube is removed, if everything is normal, they can try for either IUI or naturally they can try. In this case, it is stage 4 endometriosis. That is, it is severe endometriosis. That is, all uterus, ovary, tubes are attached and nearby structures, the bowels, everything is attached. So we will try to remove, separate each and every structure, try to remove the adhesions. If there is any, through surgery, through laparoscopy, we will try to remove all the things. And then if the tubes are identified, we will either remove the tubes or separate the tubes from the uterus.
Okay. So if the tubes are to be removed, if the situation is like that, then IVF is the only option available.
If both the tubes are removed, IVF is the only option.
Dr. Swetha, question to you. Is endometriosis age related? If so, at what age does it generally occur?
Sir, endometriosis is actually there are two types of endometriosis. Something like adolescent endometriosis, or there can be something like which can be seen in a reproductive age group. Again, in these things, adolescent is age group where usually at the time of onset of menarche, that is onset of period, it can be seen. Here, the periods are usually very painful, very irregular, and with severe fatigue and chronic back pain. These are the ways the adolescent girls usually present with.
Okay.
This is usually if the ovaries are affected, then only probably surgery is required. Otherwise, we can put her on contraceptive pills, or there are other medicines like agonist injections and all that. So these things it can be really treated. But then again, most commonly endometriosis in a general population is usually 2 to 10% incidence is there. But when you take an infertile population into account, then it is about 20 to 50% incidence of the endometriosis. Most of them usually in the reproductive age group of around say 25 to 30 years. This is the most common present disease.
Okay. Dr. Maheshwari, are there things that lady can do to prevent fibroids, prevent endometriosis? Are there any prevention techniques or mechanisms or lifestyle changes, etc., that can
So
help?
one thing is we tell them lifestyle changes. In that they should have a healthy diet, avoid oily foods, spicy food, outside foods, and all. And also, if they're if there is any history of smoking or alcohol intakes, that has to be reduced. And also, there is no particular diet which will cause fibroids or endometriosis. So, only thing is if our immunity is very good, the chances of endometriosis reaching the severe stages is less. Because there is one more factor: if the immunity is less, the endometriosis grows faster. So that's why I try to have a vitamin C rich diet like lemon, orange, moussamis and all, like gooseberries and all. So otherwise, have a healthy diet, normal sleep and regular exercises.
Okay. So being physically active is one good suggestion for preventing all this. But is it hereditary, Dr. Maheshwari? Do these things come as a hereditary?
Yeah, actually, there are few theories and a few research papers which have suggested there is some genetic cause for even the fibroids as well as for endometriosis. But that is not a major cause. So it is not a genetic disease, but there are certain genes. If they are abnormal, the fibroids or the endometriosis can develop. So in few they have seen it is running in the families, the fibroids. If mother has fibroid, the elder sister will have fibroids and the younger sister will have. It is not a must. If the mother has fibroid, doesn't mean if she has a female child, that child will also have fibroid or endometriosis. Certainly there is a genetic cause for it, but it is not like the major one.
Okay. Dr. Swetha, question regarding fibroids. suppose a patient undergoes treatment for fibroids, let's say surgery is done and all that, are there chances of it reoccurring?
Yes, sir. There are definitely there's chance of recurrence is there in fibroids. Almost like in 20 to 30% of patients, in a post-operative period, do have a recurrence. It's not like once the fibroid is removed, the fibroid problem is solved. No, there can be recurrence, but it can depend. It can be either in the immediate future or it can be somewhere later in the day, or it can never come also. But then yes, 20 to 30% recurrence is still there.
Okay.
Because I want to clarify, yeah, as Dr. Swetha said, there will be microscopic deposits of this fibroid tissues inside the uterus. So when we remove, we will remove bigger fibroids. So this microscopic deposit cannot be seen through laparoscopy. Over the year, they'll respond to the hormones and they will increase in size. So usually they'll increase up to 45 to 50 years. Usually after menopause, in majority of the patient, they won't increase in size. But definitely there is chances of recurrence. Once we have laparoscopically removed all fibroids, means it is not that in her lifetime she will not get the fibroids again. Even the endometriosis can also recur even after surgery.
Okay. So endometriosis also there is a chance of recurring. So same with the case of fibroids.
Yeah, it can increase in severity also. That's why we tell whenever we have done a surgery for fibroids or endometriosis, if they are trying to conceive, try to conceive as early as possible. Within 6 months, the chances of conception is better in endometriosis.
Yeah, that's a very important message actually. So if there are people who are listening to this show and wondering whether they should try to conceive now and if they're suffering from endometriosis or fibroids, the message from both the doctors is that try and conceive and complete your family as quickly as possible so that the chances of it reoccurring or becoming more serious is not going to prevent you from having a pregnancy later. So a lot of couples are asking about availability of consultations at all our centers. Just want to remind all our viewers that all our 5 centers are open now. Doctors are available. Consultations, both physical and online consultations are available. Visit our website www.garbhavudi.com or call 888-0000-909 and book an appointment, and you can have your physical consultations or online consultations. Dr. Swetha, in all your practice that you have seen so far, what is the most severe case of endometriosis that you have seen and how was it managed?
Sir, probably in my experience, I have seen cases of severe bilateral ovarian endometrioma, which are pretty huge, almost like 5-6 centimeters in size. And something like frozen pelvis also associated, because all these, once we say ovarian endometrioma, it is definitely a stage 4, but the severe endometriosis kind. So probably in these patients, even though the AMH levels are considerably normal, the ovarian reserve is very bad. Probably in such cases, what we usually do, and in these cases, most of the time, almost in 90% of the cases, the tubes are affected. So we can't try for a simpler management. We have to go in for an artificial reproductive technique. So in such cases, in one of my patients, what we actually did was like we did an IVF, we did a controlled ovarian stimulation, we retrieved the egg, even though the endometriomas were there. Then probably once the egg pickup was done, then we did a surgery to get the endometriomas out, or put her on a agonist depot preparation for 3 months duration, then get the hormone levels under control, then do a frozen embryo transfer. It's a very good high success rate are there if at all we follow this technique.
Okay.
So severe cases which I have seen in my experience.
Okay. Maheshwari ma'am, you want to add? I mean, any case
So
that you've seen on endometriosis?
In endometriosis, what happens because of adhesions, that is, the uterus, tubes, ovaries will be attached to the other nearby structures. Because of that, what happens? The normal ovary and tube function will be altered. So if the normal tube and tubes and ovaries position is altered, what happens when the egg is developed? So when it ruptures, that is, if the ovulation happens, the egg will not reach the fallopian tubes properly. So if the egg doesn't reach the fallopian tube properly, that means the eggs and sperms, they will not meet in the fallopian tubes. That will lead to many cycles of failure naturally if they try naturally, or if they try IUI also. That is also one of the reasons. They will be wondering why the ovulation is happening, endometrium is good, sperm is good, so IUI is done, still there is a failure. Even in scan, we cannot check the anatomy, normal anatomical relationship of the ovaries and the fallopian tubes. That is also one of the reasons for failures.
Okay. So, in your experience, Dr. Maheshwari, which is the most complicated fibroids case you've successfully handled?
So there was a couple who had come with multiple fibroids which were very close to the endometrial cavity. That is the place where the embryo implants and it grows. So almost she had 10 to 12 fibroids.
Wow.
So we had removed all the fibroids and we had given her almost 4 to 6 months of break for the uterus to heal properly. And then after that we have done her embryo transfer and she has conceived. So and also like she delivered through cesarean section without any complications and she is having a healthy baby.
Okay. Dr. Swetha, question to you. In the case of a lady with fibroids, let's say surgery is done, is IVF the only option for fibroids?
No, sir. Again, it depends upon what exactly is the age of the patient, what exactly is the ovarian reserve, the position of the tube, the husband's semen parameters. If everything is fine, just the fibroid is a problem. Then once the fibroid is removed, we can plan for a simpler technique. Again, depends upon what exactly is the status. If everything is fine, we can definitely go ahead with the timed intercourse or as simple as intrauterine insemination procedures can be done.
So here I want to say one interesting topic. So I was 30 years with a fibroid which is measured 6 centimeter in size.
Okay.
So otherwise our ovaries were normal, ovarian, the number of follicles in the ovaries were normal, semen parameters was also normal. She has tried many cycles of natural intercourse. She was not able to conceive even with ovulation induction and had tried IUI also.
Okay.
So we did we laparoscopically we removed the fibroid, gave 3 months break. So after that, with simple ovulation induction, that is, we gave medication for the follicle development. With natural intercourse, timed intercourse only, she conceived and she delivered also without any complications in pregnancies.
Okay. Dr. Swetha, question to you from Gautam Kumar PR. How do women know for sure that they have fibroids?
Sir, again, if the patient usually has any menstrual disturbances, the heavy flows, or painful periods, or repeated miscarriages, or inability to conceive, these are the things which again we say may be fibroids. But again, a definitive diagnosis is by ultrasound. Ultrasound pelvis will have to do and then diagnose.
So, an ultrasound scan can certainly diagnose the challenge of a fibroid. Existing.
An experienced radiologist, yes, definitely picked up even the small fibroids can be picked up.
Okay. Dr. Maheshwari, is there a relationship between PCOD and endometriosis and fibroids? Is there some connection between those three? Or is there any?
So actually, these are the common gynecological problems in the reproductive age group. So a patient with polycystic ovary syndrome, that is, they will have more number of the eggs, that is, more number of follicles in the ovaries will be enlarged, and the hormonal imbalance will be there, and their cycle will be irregular, and the ovulation will be a problem. And those patients who have this polycystic ovaries can also have fibroid uterus. Fibroid uterus is an independent disease, and also the PCOD is also an independent pathology. Even endometriosis can coexist with fibroid or with PCOD patients. But endometriosis and PCOD is a little bit less compared to polycystic ovaries and fibroids.
Okay, so polycystic ovaries and fibroids are seen off. Okay.
Yeah,
often.
Together can be seen often.
Okay, and the treatment options for PCOD and fibroid?
So actually, if it is there, if there is an indication to remove the fibroid, we can do a laparoscopy where we can treat both the condition. If the ovaries are large in polycystic ovaries, we do a ovarian treatment. That is, we will destroy a little bit of ovarian stroma so that hormones will be normal.
Okay.
And also they respond better, ovaries respond better for the medications. And also in the same setting, we can remove the fibroids also. In the same settings, both the conditions can be treated. Even if a small minimal endometriosis is there, like a spots, we can coagulate those spots and we can prevent its progression.
Dr. Swetha, a question to you from Archana. I have already completed my family. I have 2 children. I have been diagnosed for fibroids. I've undergone surgery twice. Now I've been suggested hysterectomy. What should I do?
Sir, again, in this case, what exactly is the size? She's already undergone 2 previous myomectomy, fibroid removal surgery. Now, right now, what exactly is the size of the fibroid? First thing is important, whether should we really plan for hysterectomy or not, whether she's symptomatic or not. If there's no, absolutely, the fibroid sizes are very small, if there's no symptoms as such, and if she doesn't have any family history of cancers, then probably we can actually leave these fibroids alone with just regular follow-up, monitoring with the ultrasound. But again, if she's like really symptomatic, or if there's a cancer history in the family, I mean, in these cases, or a big fibroid, in these cases, we'll have to look into what next option.
Okay. If a treating doctor has recommended hysterectomy, probably severe symptoms or chances of cancer in the family, something like that could be possible, right, doctor?
Yes, sir. Yes, sir.
So
could be possible.
So to give an advice, do you want to see more information about this patient, or can we already advise what needs to be done?
Sir, at this point of time, I know she's been previously had 2 surgeries and she's been advised. But apart from that, we don't know any other details. It's good we personally see the patient and then take a decision kind of thing. If she can get a second opinion for the same, then probably we can.
Okay. Maheshwari ma'am, you want to add something there?
So usually it is better to check the previous record, whether what medications were given for what long, how long. So whether she has responded for those medications or not. And over the period of time, whether the fibroid has increased in size, that is also very much important. If the fibroid is increasing in size and its vascularity is increasing, so then usually the surgical method like surgical removal will be advised. And also, suppose if she doesn't want hysterectomy, she doesn't want to get her uterus removed. So laparoscopically, we can remove only the fibroids also.
Okay.
So if we see the records, what is the fibroid size, where it is located, whether it is responded to the medications or not, if we see that, we will get an idea.
Okay. Typically, what are there fibroids that respond to medicinal treatment, or do all fibroids require surgery, Dr. Maheshwari?
So usually, if the fibroids are very small, like say 1 centimeter or 2 centimeter away from the uterine cavity, or it is outside the uterus and it is not producing any symptoms. If it is asymptomatic, not causing any problems, usually we don't treat it. So only symptomatic treatment we give. That is, so if they have pain during menstrual cycle, we will give medications for the pain to reduce. Or if the bleeding is more, we'll give medication for the bleeding to come down. Suppose if they have prolonged bleeding, like 10 days, 15 days of the bleeding is there, or they have any flow, then we may give a hormonal therapy like progesterones for 2 to 3 months. So usually they will respond. And also there are certain medications which is known to reduce the fibroid size. So that also we can give. And also like there are newer drugs in the market. So they are known to reduce the fibroid size. We can give it for 2 to 3 months. And also lipid injections are there, that also gives a relief. So it depends upon the size, what is their symptom. Suppose if they are trying for pregnancy, so we will see the fibroid size. If it is big, we will remove the fibroid and give the treatment for the pregnancy to happen. Or if the fibroid is small, we can directly start the treatment for fertility.
Okay. Dr. Swetha, I read somewhere that there are some advanced new age treatment available for fibroids, something related to laser and all that. Do you know something of this, or is it just hearsay?
No, sir. Yes, there are definitely newer treatments for fibroids which are available, either in the form of high frequency radiation lasers are there. There's magnetic ultrasound imaging or radiations again. Focused radiations are there. There's something like uterine artery embolizations are there. These are the other simpler techniques instead of a hysterectomy. These can be tried if they have completed their family and they are not in favor of another pregnancy kind of thing. And probably these are the various other options which are available instead of a simple myomectomy or a simple hysterectomy surgery.
Yeah, I would like to add 2 points. Those who are not willing for surgery or those who are not fit to undergo surgery, that is, they have a serious medical problem, giving anesthesia may be problem, or they have some severe cardiac conditions and all. So in those cases, what happens? They will be like thinking like if I undergo surgery, there is a risk factor, and they will be suffering with the disease without taking proper treatment. In those patients who is not fit for surgery, also we can give medical treatments. If it fails, like she said, like we can go for uterine artery embolization. That is the uterine artery. The medications will be put so that blood supply to the fibroid will be reduced, so that its growth reduces, symptom reduces, and the bleeding and pain reduces. And also one more thing is under MRI guidance, we will send a focused ultrasound, that is will pass the ultrasound wave to the fibroid itself.
Okay.
So that its size reduces.
So it's like cancer radiation therapy that is done in cancer. We get some water for that. Dr. Swetha, there's a question. I am 5 months pregnant, and now fibroids have been detected. What should I do? What are the things I need to take care to ensure that I don't lose my pregnancy?
Probably in these cases, probably what we can do is if only the fibroids are detected, but she doesn't have any infection of the fibroids, the rate degeneration, what Dr. Maheshwari was explaining earlier. Probably if she doesn't have any infections, if she doesn't have any severe pain of abdomen and all that, then probably we can just monitor the fibroids through serial ultrasound scanning, and then limit the physical activities, probably the good lifestyle changes without switch and all that. And towards the end of the day or end of the pregnancy, probably we'll have to plan for a restricted activity kind of a thing. Because once the fibroid is there, in the middle pregnancy, the red degeneration infections are very common. Towards the end of the pregnancy, preterm labors, fetal growth restrictions, antepartum hemorrhage, post-delivery or postpartum hemorrhage, all these are commonly seen in patients with fibroids. Probably these are the things which have to be kept in mind, and a proper monitoring of pregnancy has to be done.
Dr. Maheshwari, we have a question from Deepika Radha. It's not related to the topic we are talking today. The question is, I'm 46 years old and all my reports are fine, 46 years. Can I conceive? Is the question.
So one thing is, as age increases in females, the number of the follicles also reduces. And also the quality of the egg also reduces, as well as the uterus implantation potential. That is, the embryo has to go and attach to the uterus. That potential also reduces with increasing age. And also, like after 35 years, if the maternal age is after 35 years, what happens? We tell it as like chromosomal abnormalities of the child being born to an elderly mother is more. So as like from 35 to 40 years, suppose if it is 2 to 5% of the unemployed is, that is chromosomal abnormality. Between 40 to 45, it will be around 5 to 10%. After 45 years, more than 10% we can see there is chromosomal abnormalities. So if she is trying to conceive, like we have to check all the parameters, whether the uterus is normal, the number of follicles are normal. Even if she conceives, we have to do certain tests to check whether this chromosomal problem is there in the fetus or not.
Okay. So I just summarize your answer for Mrs. Deepika. Conception is possible, but because the age is 46, advanced age, there are chances of complications. So working with the right specialist would be a good option. With proper monitoring is the way to go forward. Is that correct, Maheshwari ma'am?
Yes.
Okay. So we are coming to the end of our talk today. I just want to remind all the viewers that all our centers are open. All our 5 centers are fully functioning now. You can fix appointments by either visiting our website www.garbhavudi.com or call us at 888-0000-909. Fix an appointment and get a consultation, either physical or online, with our doctors. Before we end the show today, Dr. Maheshwari, do you want to give a take-home message for all our viewers?
So my take-home message is, whoever is suffering from disease with fibroids or endometriosis, don't panic. Don't think it is one severe disease with which you cannot conceive only. take an expert opinion, get the proper scanning and also proper reports done. If required, go for a laparoscopy. Don't get scared if a doctor advises you laparoscopy. So usually for your benefit only it will be advised. So through laparoscopy we can correct the endometriosis condition as well as if fibroids is there, we can remove it. So and with the proper treatment definitely you can conceive, and also don't postpone your pregnancies. So if the condition is diagnosed, try to conceive as early as possible. After undergoing laparoscopy, the chances of conception in endometriosis is best within first 6 months. So if you try to conceive, that is best. And also one of the best natural remedy for endometriosis is pregnancy itself. So if you become pregnant for almost, it is like 9 months, and also in lactation period around 6 months you take it. So on an average, like almost for 1.5 years, the cycles like menstrual cycle will not happen. That is, the hormonal variations won't happen and the endometriosis will not progress. So that is also one of the things. So don't panic, take the treatment as early as possible. Always take an expert advice.
Thank you, Dr. Maheshwari. That's a very nice message. Dr. Swetha, any take-home message from your side?
I think Dr. Maheshwari has summarized it all. But in addition, I would say probably in this stressful lifestyle, whatever we have in this generation, probably we'll have to focus more on a healthy lifestyle, healthy diet, exercise, all these things, and without postponing a pregnancy due to work-related issues, plan a pregnancy earlier, and take the right guidance at the right time. Probably give you a successful future.
Okay. Okay. Thank you, dear Dr. Maheshwari. Thank you, Dr. Swetha. Thank you, my dear viewers. I just want to remind you that GarbhaGudi has been awarded the best IVF and fertility center in India by Quality Achievement Awards, and we are also figuring in the top 10 best IVF centers in the whole of India. This survey was done by Times of India. So we are very proud to announce these 2 awards. Our next live program is today at 8 p.m. Dr. Priyanka Rani will be talking about menopause and certain other complications around menopause. You can always come on live on our YouTube and Facebook and watch this program. Dr. Priyanka Rani is a fertility specialist at our Electronic City Center. So thank you, dear viewers. Thank you, Dr. Maheshwari, for your time and sharing your knowledge and expertise. Thank you, Dr. Swetha, for making time amidst your busy schedules and giving so much information to our viewers today. Have a fantastic weekend, everyone. Thank you.
Thank you, sir, for providing this platform and providing this opportunity so that we can convey the messages to those who need their help. And thanks a lot.
Thank you.